Today, we're going to discuss 7 common myths about dissociative identity disorder. And myth number 1 is that doctors are good at diagnosing DID. And this is sadly false. It's been estimated that patients with DID spend on average 5 to 12 years in the mental health system before obtaining a correct diagnosis, and that they receive an average of 3 to 4 incorrect diagnoses before getting the right one. Myth number 2 is that dissociative identity disorder is an adult onset disorder. In reality, this is very much a childhood onset disorder. It's been estimated that over 90% of those with DID have experienced some form of childhood abuse, and every study that has looked at childhood trauma and DID has found the highest rates of childhood adversity in this population compared with any other diagnostic group. And generally, what we see is that trauma begins before the age of 6 years old. And so remember, children in this age range are generally not able to fight or flee with stressful experiences. They're either incapable of or too slow to run away, and they're too small to win a fight. So instead what they do, right, their little brains protect themselves by disappearing or dissociating. They try to escape from what is happening to them on the outside by running into their safe inner world. Myth number 3 is that people with dissociative identity disorder are fantasy prone, highly suggestible, and confabulators of their past experiences. And one of the biggest debates is whether or not dissociative disorders are related to psychological trauma or are secondary to confabulated trauma memories. And what I want to do real quick is to, define some of these terms because it could get a little confusing. So fantasy prone is a phrase used to describe patients with a certain cluster of personality traits. Generally, what we see is that these patients are able to create a very vivid fantasy life and might have difficulties telling the difference between what's real and what's imaginary. So as a child, they might have been excessively into imaginative play, and they maybe had a lot of make-believe friends. They might have fantasized so much that those around them describe them as being daydreamers or as being spaced out a lot. And many are described as having overactive imaginations and are said to be living in a dream world. And generally, these people are thought to be good candidates for hypnosis. So what some critics of dissociation will say is that those with DID have memory errors in their recollection of past events, or they might have repressed false memories that were implanted in them by others. And in reality, there are no studies, okay? Let me repeat this. No studies in clinical populations to support these models that critics suggest. So instead, what research shows is that there's more evidence for something called the trauma model. And there was a meta-analysis of over 1,500 studies looking at evidence of the trauma model versus these other models that critics have suggested. And the authors of this study concluded that, quote, there is strong empirical support for the hypothesis that trauma causes dissociation and that dissociation remains related to trauma history when fantasy proneness is controlled. We find little support for the hypothesis that the dissociation trauma relationship is due to fantasy proneness or confabulated memories of trauma. My friend, if you're finding value in this video, make sure to hit that subscribe button. Now, myth number 4 is that those with the dissociative identity disorder are low risk for suicide and self-harm. And this also is sadly incorrect. In clinical studies, 92 to 100% of patients with DID endorse current or past suicidal ideation, with 60 to 80% reporting a history of prior attempts. Also, over 75% report a history of self-harm. When it comes to working with patients with DID, establishing safety must be a priority. Myth number 5 is that dissociative identity disorder is the result of a shattered personality. And this is actually a common misconception and an old way of viewing the diagnosis. People used to say that traumatic experiences would break down your personality, leading to fragmentation of one's mind and a separation of personalities within the body. Newer beliefs are more consistent with the idea that one's personality actually starts off not fully integrated, and that integration happens somewhere between the ages of 7 to 9 years old. So if you were to experience trauma before this age range, your brain would react by preventing your personality from developing into one singular personality. This then causes one to have multiple senses of self. Myth number 6 is that people with dissociative identity disorder have poor insight and are out of touch with reality. What we actually see though is that those who have been clinically studied have been shown to have good reality testing, diminished cognitive distortions, and a hyper-developed capacity to observe their own psychological processes. What we see is that early life dissociation can be a protective and a resilience factor for some people. Myth number 7 is that those with dissociative identity disorder are attention-seeking and are making their symptoms up. Actually, we've seen real brain changes in those with DID. So when putting women with DID in an MRI, it was found that they had significantly reduced hippocampal and amygdalar volumes compared to healthy controls. So no, this diagnosis isn't something that's just made up. Now, if you're looking to learn more about dissociative identity disorder, make sure to click that top video.